Hello, I am Dr. Bharat Sarvode, consultant psychiatrist at my clinic at Chinchwad Station, Pune. I am going to speak about the early signs and symptoms of depression and anxiety and how you can prevent it from getting worse. One thing to remember is that depression and anxiety might seem simply pretty different, but they do share several key signs and symptoms. For example, anxiety often has irritability as a symptom. People with depression may feel more irritable than sad. However, these conditions show up differently from person to person. So you may get confused about what your symptoms means. Though anxiety and depression are very common symptoms in patients, those patients who are suffering from anxiety do have depression later, or there are mixed symptoms of anxiety and depression. It is from the survey, it was noted, and from research also it was confirmed that all anxiety patients, many times 60 to 70% have depressive symptoms, and depressive patients, those who are diagnosed with depression, they have 70 to 80% patients sometimes have anxiety symptoms. Let us break down the signs and symptoms of depression and anxiety to catch them early and halt the progression of these conditions. Because in psychiatry, many times patients show to the psychiatrist very late and sometimes more complications happen. So it should be diagnosed very early. As in preventive medicine, we always say prevention is better than cure, or early diagnosis and prompt treatment are very important. So to get diagnosis as early as possible, you should consult your therapist or psychiatrist as soon as you get symptoms of anxiety or symptoms of depression. It is not uncommon to feel sad or hopeless during difficult situation or when we are in crisis. But when this feeling persists for 2 weeks or longer and our day-to-day functionings are getting disturbed, or more positive events do not change your mood, it can be depression. Along with this feeling, you might lose interest in your activities, feel tired, angry, or irritable, have a lack of energy or sleep problem, or difficulty in concentrating. When these symptoms are there for more than 2 weeks and most of the day you are feeling depressed or low mood, then this is an alarming sign that you may have depression, so you should take treatment. Talking about anxiety, this is a very common feeling as we are all feel sometimes anxious when we are under stress. Majority of people experience some anxiety before major life events because anxiety is how you respond to stress. But if you continue to feel persistent anxiety on most days for several months, you could have anxiety disorder. It is important to know that not anyone with depression, anxiety, or both the conditions will experience same symptoms. Both the conditions have several same symptoms such as change in sleep patterns or energy level, increased irritability, trouble with concentration, focus or memory problems, aches and pains or stomach issues that have no clear causes. If you have been feeling such symptoms for the past few days, good. Next step would be reaching out to a mental health professional. To keep one mind thing is that when you are visiting a therapist, be honest and open about your mood description, which will help them better understand how you are feeling, which can lead them to correct diagnosis, halting the progression of depression and anxiety. There are many options available when it comes to the treatment of depression and anxiety. A mental health care professional will help you identify symptoms early and help you with most feasible treatment options. As anxiety and depression are very common, one should be very careful while one is feeling about both anxiety and depression, and if they are bothering you in day-to-day life, your work pattern is hampered, your biofunctions are disturbed, and you are feeling not normal as you were feeling before that condition. So it is your duty to come as early as possible to the normal condition, and for that expert opinion is many times very helpful because they are very much trained in the field. So that with counseling, with therapy, sometimes you may need medication, and along with all this modality of the treatment, you will feel very good as soon as possible, because it takes some time for drugs to act, and within couple of weeks or couple of months you will again feel normal. So on this day I will suggest you, as soon as you get some symptoms, early symptoms of anxiety and depression, you should consult your therapist, psychiatrist, so that further complications like today's topic, because most of the depressed patient, they have some suicidal ideation, or when retrospectively we examine all those who have partially attempted suicide, they found there was a depression inside, there was lots of anxiety, and their coping mechanism was not that much powerful. So to prevent all these complications later on, one should consult the therapist or a psychiatrist as early as possible and seek treatment from that. Thank you very much.